Mental health challenges in the workplace are often overlooked, degraded by COVID-19, and despite growing awareness, they are not included in mainstream public health discourse. The AajTak India Fit 2022-23 report reveals that financial instability and the current workplace environment are the top two major stress-related factors among over 10,000 individuals. A report reveals that 26% of Indians experience workplace stress, while 17% experience financial instability due to long working hours, low wages, and fierce competition. The stigma surrounding mental health issues hinders employees from seeking help at work or outside, as they struggle with pressure and mental health issues. Psychotherapist Nikita Benjamin tells India Today that the professional world's competitive environment often exacerbates fears about mental health, leading to reluctance to discuss it with loved ones due to perceived weakness. Dr. Sneha Sharma, a psychiatrist, tells India Today that the Mental Health Care Act of 2017 is a government initiative aimed at protecting individuals from workplace discrimination and fostering an environment where they can share their struggles. Now Jay will shed light on how can you tell if a coworker is having trouble?
Thank you, Sana. Now let's talk about how we can identify mental illness in the workplace. Here are some points. Our expert Nikita Benjamin warns that prolonged deviation from baseline behavior, particularly in work-related activities, is a red flag. One of our expert Dr. Ashutosh Shah, psychiatrist, tells India Today that since psychiatric disorders reduce the lifespan of a person from anywhere between 7 to 30 years, one shouldn't underestimate the impact it can have on the quality of life. Psychiatric disorders increase the risk of somatic disorders like hypertension, diabetes, stroke, heart diseases, cancers, autoimmune disorders, and obesity, while chronic medical disorders increase the likelihood of developing psychiatric disorders. Now let's have a look at what mental illnesses may show up as. Emotional functioning. The individual experiences negative thoughts, difficulty concentrating, ruminations, indecisiveness, procrastination, reduced motivation, suicidal thoughts, hallucinations, and delusions in their executive or cognitive functioning. Memory issues, which includes forgetfulness, delayed recall, and difficulty learning new skills. Behaviors that result in a loss of self-control, reduced socialization. Biological disturbances in sleep, appetite, speech, motor movements, digestion, constipation, acidity, and bowel movements. Immune problems such as frequent infections, pains, feelings of sickness or fatigue, and abnormalities in lipid and sugar levels. Issue in cardiovascular system such as reduce in heart rate, high or low blood pressure. Nervous system not under voluntary control, which can lead to symptoms such as excessive perspiration, racing heartbeat, rapid breathing, and tingling sensations. Let's unveil the hidden habits. Experts suggest that excessive self-imposed pressure to meet societal expectations, driven by social media comparisons and constant information, is a major contributor to mental health issues. Our expert emphasized the significance of addressing hidden factors like long hours and poor work-life balance to foster a healthier work environment, highlighting the need for disconnecting from social media. Engaging in activities that bring joy is a significant factor in enhancing mental health. Poor nutrition, lack of exercise, and inadequate sleep are other habits that negatively impact mental well-being. Now let's shed light on gender disparities. The gender pay gap and persistent domestic expectations contribute to mental health disparities between men and women. Women often face increased stress in the workplace due to unequal household responsibilities and societal expectations. This leads to higher rates of depression and anxiety. Women face emotional labor, controlling stress expressions to avoid reinforcing gender stereotypes. Harassment, including sexual harassment, lack of legal protection, and stigma can trigger psychiatric disorders. However, this issue may vary across geographic areas and cultures. A cultural shift is needed to address these issues. That's all from my side. Now Sana will tell you what's the solution for this.
Thanks, Jay. Now I will tell you about the solutions. First things first, speak to someone. The current state of workplace mental health needs to be acknowledged and openly discussed. Counseling and therapy are crucial in assisting individuals with mental illnesses. Counseling focuses on specific issues and coping strategies, while therapy delves deeper into psychological issues, examining emotions and behaviors. Counseling is short-term, while therapy involves long-term mental well-being exploration. A mental health expert can help determine if someone needs counseling or therapy. At last, what's the way forward? Expert suggests management plays a crucial role in fostering a mentally healthy workplace, highlighting the importance of awareness sessions, flexibility, peer support, and a supportive environment. Breaking the silence on mental health in the workplace is not only a societal duty but also a strategic imperative for promoting a healthy and productive work environment.